brings a painful, burning feeling to your chest right behind the breastbone. Just by watching it, well, you might be experiencing heartburn, and almost everyone does experience heartburn at some point in their life. Dr. Randall Meisner is here to talk about heartburn and ways you can prevent that frequent pain. Good morning, Dr. Meisner. How are you?
Good. Thanks for having me.
Boy.
I was going to say, I mean, my heartburn is far more than Joey Chestnut's. After you did that American Girl story, I got two little girls, and I didn't know that that store was opening, so I may have to excuse myself for some heartburn and chest pain too. That was
the stomach acid.
That's a little scary for me.
Started to build up, did it?
Oh yes. Oh yes.
We couldn't time this interview any better because we're coming right off the 4th of July, which meant so many cookouts, so much food, lots of different foods that we might not have been eating. And well, before we get to the causes of heartburn, let's talk about the symptoms of heartburn. Most people in their lives have experienced this at one point or another.
Right.
But what it's different from person to person. What is the consistent feeling you'll get for heartburn?
So that's a great question, because any patient that comes in, I always say, what does heartburn mean to you? Some people, that's going to be a regurgitation of bad acid that happens, whether it be in the middle of the night or in the morning. Some patients, it's going to be that classic deep chest pain underneath your breastbone that can be scary and mimic heart pain, and that's why you always got to get your heart checked out first. That's the most important muscle. Some people have painful swallowing, some people have difficulty swallowing, some people may even have respiratory symptoms or even asthma-like symptoms from heartburn. So, you know, the biggest thing that I say is, what does heartburn mean for you? What are you experiencing? And you know, patients tell me that.
And it's interesting because I think for me, who I experience heartburn, I take a pill, I think you called it a PPI.
Right, proton pump inhibitor.
Sure,
that's correct.
Every single day to help keep the stomach acid down. When I was younger, it was that burning sensation. It literally was in the back of the throat.
Right.
That doesn't happen anymore. Now it's the deep behind the breastbone pain that does mimic heart pain, which can be a very scary thing. Let's touch on that, because I have a family history of heart disease with my father and his father with heart attacks. So to get that pain, obviously immediately you don't know, is it heart or is it my esophagus or is it heartburn?
A very common situation, and you're exactly correct. I mean, as we just said, that the number one thing you want to rule out is your heart. So if patients are having similar symptoms like you're having, they're going to want to contact their primary care doctor. They're going to want to get their heart worked up first. That's number 1, 2, and 3. But oftentimes, we get patients whose heart workup has been negative, and those are the patients who we would consider doing an upper endoscopy on, and that's where we make you sleepy and take a look at your food pipe and your stomach with a camera, and then see, is this somebody who's got a lot of acid reflux damage? Do they have a hiatal hernia where part of their stomach kind of comes into that chest and you lose the barrier that prevents acid from coming up into your food pipe? So very common situation.
I like a doctor who uses terms like very sleepy in food pipe.
Very sleepy in food pipe.
I like that.
Yep.
Talking my language here. So we just came off the 4th. So foods, I mean, there are some triggers that always consistently cause heartburn. What should we be avoiding if we suffer from heartburn?
So here's the thing. I'm a little bit different in this, because if you're somebody who has gastroesophageal reflux, or you have the quote disease of GERD, gastroesophageal reflux disease, usually those patients are having symptoms, whatever they may be, 2 to 3 times a month. And you can see here on the diagram what we're talking about is you get your stomach that fills up with acid when you eat, and there's a nice easy conduit that there's a little muscle between the food pipe and the stomach that prevents acid from coming up. When that relaxes too much, that acid comes up and irritates the food pipe. Certain foods can make that muscle easier to relax. However, if you're somebody with symptoms 2 or 3 times a week and you are following that acid reflux diet to a T, it'll only cure the problem in about 15 to 20% of people. So I have people coming into me and saying, I don't eat tomatoes, I don't eat fried foods, I don't drink alcohol, I don't eat, meat. And I say, well, really, that doesn't sound very fun. I mean, it's a completely impractical diet. So a lot of times, yes, drinking 3 beers and having 4 tacos at midnight is not going to be very good. But a lot of times people need medical therapy, like you said you were taking, because they're going to need it anyway, and if they're taking it, it can allow them to enjoy some foods that they may not have been able to. So I may be a little bit different on that, but I think the important thing is that altering your diet does not always do it. Now, the only thing I would add is that there are lifestyle measures that can help. Avoiding late night eating, very critical. Weight loss, Do as I say, not as I do, to, as I say that to patients, and keeping that head of the bed elevated are lifestyle measures that can help a lot.
Now, 3 easy to remember keys right there. Late night eating, elevated exercise.
Yeah, and late night eating is a killer.
Probably the worst.
Holiday weekends, we all do it.
That late night snack, it's hard to avoid.
That's right.
If people want to get in touch with Dr. Meisner, it's easy to do. The office is located at 4100 Lake Drive Southeast, Suite 205. Reach him at 616-267-7414. Thank you, Doctor.
Hey, thank you.
Appreciate